What age is the Bayley Scales test for? Have you ever wondered when to start assessing a child's development? The Bayley Scales of infant and toddler development might be the answer. This test is designed for young children and can provide important information about their growth. So, what age is it for? The most recent version, known as the Bayley 4, is intended for children from 16 days old up to 42 months, which is 3.5 years. This age range is critical because early signs of developmental differences, including those linked to autism spectrum disorder, often appear during these years. The Bayley Scales evaluate several areas of development. These include cognitive skills, language abilities, motor skills, social-emotional development, and adaptive behavior. For children who may be at risk for autism spectrum disorder, these areas are especially important. Delays or unusual patterns in social communication, language, and behavior can be early signs of autism. During the assessment, the Bayley Scales provide a structured way to observe how a child interacts with toys and people. This observation can help identify children who may need further evaluation for autism. Early identification is essential because, while the average age for an autism diagnosis is around for years, many children show developmental differences much earlier. The Bayley Scales can be part of a broader evaluation process. They help monitor development in children referred for concerns, including those who may later be diagnosed with autism spectrum disorder. The test includes items that screen for behaviors commonly seen in autism, such as challenges with social interaction and communication. If a child scores low on specific items, especially those related to social and communication skills, this may lead to a referral for a specialized autism assessment. However, it is important to note that the Bayley Scales are not diagnostic tools for autism. Instead, they help identify developmental delays and unusual patterns that may suggest the need for further evaluation. The test is typically given by trained professionals, such as psychologists or developmental specialists. They can interpret the results in the context of the child's overall development and family observations. For families concerned about autism, the Bayley Scales offer a way to track a child's developmental milestones. Using the Bayley Scales early, along with input from caregivers, can help ensure that children who may benefit from early intervention are identified quickly. This approach supports better outcomes by connecting children and families with appropriate services during the toddler and preschool years, when intervention can make a significant difference.